I will invite Professor Gianmaria Busetto, urologist, which will speak about reducing sperm DNA fragmentation with carnitine and micronutrients. Thank you very much. He's a very well recognized urologist, expert also in the biology of the testicle, of the testicular cells, of spermatozoids, and please.
Thank you for the warm welcome, and it's a pleasure to stay here to talk to all of you. So now we will try to change our topic, and we will move from the women to the men, and we'll try to understand how these micronutrients can be helpful even in men. In particular, this is a presentation a bit new because we are talking about DNA fragmentation, and I will present to you latest evidence in the literature about how these micronutrients, carnitines, and these compounds can be helpful in reducing sperm DNA fragmentation. I always start my speech with this slide because I like so much. It is an old slide. It is 1982, and is reporting that fertility several years ago was only considered something that was due to the women. Nothing was related to the man. So infertility was only due to women factor. Today, we changed our mind, and we know that the infertility crisis is beyond doubt. And there are several studies that are reporting that men fertility are decreasing year by year so much. There is this study from University of Jerusalem that we are talking about falling by an average of 1.4% per year. So you can imagine how big this is a problem. And in fact, the size of the problem is very huge because we are talking about something that is related with 80 million of couples worldwide. So today we know that infertility is a couple disease, but the male factor can be up to 50%. And sometimes we have even double problem with men and with the women. And if we look at the causes of the male fertility disease, we can see that there are several causes that can be related. But what is important is that nowadays, still 30% of these causes are unknown. So we can reach only 70% of male infertility causes. And in this 70%, 15% is related to varicocele. These data are really up to date because this is EU guidelines of 2022. So these data are really up to date. And what about the diagnosis of male infertility? Since we know that up to 30% is not, we don't reach a diagnosis, how can we go further with our diagnosis? For sure, the semen analysis is the only test that is useful and that can give us a snapshot of what is the actual situation. In this slide, I didn't have time to update, but the WHO guidelines of 2010 have been updated, and now we have the 6th version that is of previous year, but almost is the same of this situation. So it's important and really helpful making a standard semen analysis and to keep this exam as the first step of a diagnosis for male infertility. Then we can go further with the endocrine evaluation. So the hormones are really important in these patients. Testosterone, LH, FSH, inhibin, and prolactin should be dosed in these patients. And even the genetic testing, when you are facing with a severe male infertility, you should make genetic testing. And the chromosomal aneuploidy, the abnormality of chromosome, Y chromosome microdeletion, fibrosic cystic gene, and other genetic disease like Klinefelter syndromes can be cause of severe male infertility. And then there is a big amount of different tests that can be helpful for us to make a better characterization of this infertility. And I have underlined the Myoxis and the sperm chromatin integrity tests because they're really helpful. The Myoxis is really helpful because it's an easy way to measure reactive oxygen species, while this tests are helpful in making a test with the integrity of the chromatin and of our DNA. So the DNA fragmentation that can be measured in different way, it will be something that we should start using more and more. Let's start with the first one, because we heard from the previous presentation that the reactive oxygen species are really important. And nowadays we have this system that is an easy way to measure the reactive oxygen species. The oxidation reduction potential can be measured, and the transfer of electrons from a reductant to an oxidant is the way that this machine works. It's very easy, it's cheap and easy to use. And this is the evidence from the literature, where you can see that has been approved from 2016, and the data are really interesting because you can see an area under the curve that is significant. And even in a more recent paper of 600 patients, this is 2017, you see an area under the curve of 0.7. So it's something that is reliable in measuring the reactive oxygen species. And it's very helpful to us because you know that the micronutrients and compounds are used to lower the reactive oxygen species, but we should keep in mind that it's important to keep the correct balance of this reactive oxygen species. And this is the way to make a measure of the ROS and to keep the correct balance. Then the DNA fragmentation. We said that is really useful, the DNA fragmentation, and this is an interesting paper of 2016 where it is presented the different way of measure the DNA fragmentation. And this is a comparison between the four most used systems to measure the DNA fragmentation: the tunnel test, SCSA test, the halo test, and the COMET assay. So all of these are valuable tests to measure the DNA fragmentation, but we can say that there is something that is better, and from this analysis it's reported that the alkaline COMET, this one, is the one that is reporting, by the way, the best results in terms of specificity and sensitivity. But as you can see, even the other are very good, because even the SCSA, the SCD, the tunnel test, all of them are really reliable. So we have the capability to use different tests that can be helpful in measuring the DNA fragmentation. And even if when we're talking about varicocele, I told you that 15% of known causes of male infertility are related to varicocele. And varicocele can create DNA fragmentation. And this paper that I have selected is not so recent, but I like this paper because it's dividing the population, not a big population, but it's divided by subclinical varicocele, non-clinical varicocele, so normozoospermic varicocele, and astenoteratozoospermic varicocele. So I like this distinction because it's what you find in the real life. So the question that we are always asking: should we treat patient with subclinical varicocele? Should we treat patient that has varicocele but that have normal sperm? So this is interesting because from this paper you can see that patient with the clinical varicocele and after the treatment of varicocele will have a better situation of DNA fragmentation that is statistically significant. So this is in favor of the treatment of varicocele for patients that are suffering from infertility and higher DNA fragmentation. And now let's move to the oxidative stress topic, because varicocele is probably the main cause of oxidative stress, but it's not the only one, because the oxidative stress can be caused by several other factors like disease, like no good lifestyle habits. So there are several causes of oxidative stress, and it is something that we have to deal with because probably is one of the most important causes of male infertility. Today we introduce a new concept, the male oxidative stress infertility. MOXIE is the name of the oxidative stress related infertility. So we have this new concept and this is something that we have to keep in mind. Why is important? Because the oxidative stress, the reactive oxygen species, are like pinballs that bounce over the sperm, creating damages that can occur at the head of the sperm, at the mid part, and at the tail. So this ROS can create damages at different levels of our sperm. And it is a concept of amount of reactive oxygen species. If you have just moderated elevation of ROS, you will have just a sperm immobilization. If this concentration is increasing more and more, you will have a cell death. So this concept is important because you have to keep in mind that is the correct balance between the oxidation and reduction that should be kept. Because even reducing too much is not healthy for the sperm, because for the capacitation, for example, you have to keep a correct amount of even reduction potential. So reactive oxygen species should be in the correct amount. Even the mitochondria, that are the main part for the energy of the cells, receive damages from reactive oxygen species. So at different points you will have damages, and this is why you have to keep the control of oxidative stress. And one that we have understand that there is an higher oxidative stress and an infertility. How could we help these patients in reaching a better reactive oxygen balance? Antioxidants. Antioxidants for sure are something helpful. And the carnitines is probably the best one because they are able to bring the energy into the cells. They are able to remove toxins from the cells. So together with the lifestyle changes and together with a good life status, helping with antioxidants will give us more chance to have a lower oxidation. Just some evidence that are reporting the results of what I'm saying. So they are not so new, but they're really good. 2005, this is 60 patients that have been treated with acetyl L-carnitine alone or in association with L-carnitine. And you can see that all the sperm parameters increased in these patients. And the association of LC and ALC is the best way to obtain this increase in our fertility. And the pregnancy rate, in this paper, the pregnancy rate was not the first endpoint, but the authors report that 7 pregnancies occurred in patients treated with the association of ALC plus ALC. So even these parameters has been increased significantly. There is even later a meta-analysis that is reporting that all the sperm parameters, so the morphology, motility, progressive motility, all of these are increased after the treatment with compounds. But let's move to something more recent. Last week, I wanted to make a search and I wanted to see if there was something that were connecting the DNA fragmentation that is something more up to date with the use of micronutrients. And I found 4 interesting papers. There is something that I want to present to you. So this is the first one, it is 2021, and this is the effect of L-carnitine on apoptosis and DNA fragmentation. So this was a group of patients that received the L-carnitine, and then they measured 2, 4, 6, and 24 hours the mitochondrial membrane potential and the DNA fragmentation. And the results are quite interesting because you can see that all these parameters, after the treatment with the carnitines, had a statistically significant decrease. So it seems that the antioxidants are able to reduce the DNA fragmentation. So they're able to reduce the damage of the DNA that is fundamental for the fertility of the man. This is the second paper. This is the only one that is reporting that antioxidants are able just to increase the sperm concentrations, but they are not reporting a DNA fragmentation changes. But in any case, this paper is reporting that the antioxidants are in any case useful to increase your sperm quality, even if not changing the DNA fragmentation. This is another one that is 2021, and is once again reporting that oxidative stress and the DNA fragmentation are associated with decreasing the percentage of normal sperm form. So it's saying that DNA fragmentation is important for our fertility. Varicocelectomy and antioxidants improves the percentage of normal forms of sperm, so sperms will be better, and decrease the DNA fragmentation and increase the pregnancy rate. So all of the important parameters are affected positively by the antioxidant and even from the surgery of varicocele. And this is the last paper, 2021 again. Even here, we have a group of patients that have been treated with L-carnitine, and if you look at this small graph, I will show to you, all the parameters, motility, density, forward motile sperm, DNA fragmentation, and deformation rate, once again, are statistically significant improved in comparison with placebo. And this is the conclusion that I like. So we are talking about empirical medical therapies because it's something that is empirical. This is a promise or a panacea? In general, we can say that if you use the correct antioxidants, you will have an increase in the quality of your sperm. And this is even reported in the latest EAU guidelines. If you look at the 2022 EAU guidelines, there is an important changes that there wasn't next year. This year, they are reporting that antioxidants use may improve semen parameters. Finally, the guidelines are reporting that even if the strength is weak, but finally they are using the term that antioxidants may improve semen parameters. What I'm saying from several years, because now I will show you my experience and I will report my results, but because I always trust in antioxidants, in an improvement of your sperm. And this is why I'm presenting my experience that started this is mainly the first publication, but in reality I have something even older, but this is the first that is significant because this is a study that has been conducted in a double-blind, placebo-controlled way. So it's something that I like to report because I believe that the results are reliable. We took 100 of patients that have been treated with supplementation or with compounds, and they have been divided between varicocele and non-varicocele. This is the study design, 104 patients, 52 varicocele, 52 non-varicocele, placebo and supplementation, and they have been divided like this. All the parameters of the sperm are better in comparison with the placebo. And when we are talking about varicocele patients, the results are even better. So this is what I'm reporting with a double-blind, placebo-controlled study. And as I told you, all the parameters are statistically significant. If you see the difference between treatments and placebo, all the parameters are statistically significant. And even the secondary endpoint, that was the pregnancy rate, is interesting because 12 pregnancies occurred in these 104 patients. Mainly, all of these patients were seeking a pregnancy. 10 in the treated patients. 2 in the patient that were receiving placebo, and 1 became an abortion. So even these parameters is interesting. And this is what I wanted to report, that my trial in 2021 has been reported as one of the most highly cited paper worldwide. It's the number 17 in the worldwide ranking. So it's something that has been cited so much, and something good and something really reliable. And even the compound has been reported as the 10 most common commercial dietary antioxidant reported. So even what we used for our study is the first by worldwide ranking. Then I continued with this study because I had a really beautiful database, data set, and I try to focus on our lifestyle habits. So is our body mass index and our age correlated with the action of this antioxidant? So older people and obese people, will they have a different results with these compounds? In my mind, I was thinking that probably this patient should receive a better results, because aging and body mass index, as we even heard before, are more related with reactive oxygen species that are increased. So I was expecting that this patient were having a better action and a better increase in their sperm parameters. And what I found is that a significant difference in supplementation efficacy was observed for total motility on patients with varicocele and with a body mass index inferior to 25. And for the responders analysis, total motility were confirmed in both the cited group and the varicocele group, with a body mass index inferior to 25 and ages inferior to 35. So I found exactly the opposite of what I was expecting, because it seems that patients younger and patients not obese are responding better to therapy. And probably, this is what I'm trying to understand, is related to the dosage. Probably obese people should receive a higher dosage. We should control better, measuring in a good way the oxidative stress, and maybe we will have, even with them, better results. And finally, these are the results that are statistically significant. And nowadays, we started a new trial, because on the previous trial, even if it was a double-blind, placebo-controlled trial, even if it was very strict inclusion and exclusion criteria, we were not measuring the reactive oxygen, the ROS, and we were even not measuring the DNA fragmentation. This is why we started in January 2021, after several difficulties due to COVID, due to other reasons. Finally, we obtained the ethical committee approval in 2021, and now we are focusing on a population only of varicocele patients that are 82 patients. We started enrollment approximately 1 year ago. To date, we have 42 patients enrolled. Unfortunately, due to COVID, once again, we are not so fast in enrolling patients, but we have reached already 42 patients. We hope to close the enrollment by the end of the year, and I will be happy to come back next year to present our results of this new trial. This is my conclusion, that as for any drugs, clinical efficacy of any natural compounds must be demonstrated by double-blind placebo-controlled trials. This is really important. And for the future, the infertility can be considered as a proxy of general male health. I hope that in the future we will consider our fertility as a snapshot, as a picture of our general health. So maybe this is one trial, and this is something reported even in our last EAU in present Congress in 2019. Maybe the male fertility can be an indicator of our male health status. Thank you for your attention.
Thank you very much, Professor Busetto. That's fantastic view also of what happened in the other sex and in the human and the male infertility. Please, do you have any question? Yes, you can go to the microphone.
Artur Wdowiak from Poland. Professor Busetto, we all know that reductive stress is harmful for semen parameters, and last year it was published a very interesting article about reductive stress. And we know that Mioxis can detect reductive stress, but you must connect it to computer. If you don't connect it, it only can count 0 and not minus values. And tell me, what do you think? Do you have idea how to help patients with reductive stress? We know that antioxidant couldn't help them. Thank you.
This is probably the most important point, because you know that antioxidants should be used with careful. Because if you give too much antioxidant, you will have the opposite effect. So you have to keep the correct balance between reduction and oxidation. Because if you reduce too much, you will have a damage as well. For example, the sperm, for its capacitation, it needs a correct balance of reduction and oxidation. So the myoxis can be helpful in measuring this balance, because if you give too much antioxidants, you will have the opposite effect. So with the myoxis, you can do serial measure of your reduction and oxidation, and you have the capability to give the correct amount of antioxidant to these patients. So one question that often they ask to me, so how much antioxidant you give, for how long, how many times a day? I can say that probably you should give for a minimum of 4 months, because if you keep in mind that the sperm process, it takes something like 90 days, probably the 4 months is the minimum. But probably is better to measure with the myoxis how to give these compounds. So this is the point.
Thank you. Yes, you can.
And
you can go to the microphone.
I have different observation about how to manage doses, because I detect myoxis. I make first measurement after 1 month of treatment of antioxidants, and after 1 month I see that it acts. If it doesn't act, I increase doses of antioxidants. Thank you.
I am completely agree with you.
Thank you, Professor Busetto,
Muni,
for this nice talk. My question is when we treat with antioxidant and we have a high rate of DNA and fragmentation, and when we treat with 6 months and we haven't a result. The DNA fragmentation is usually high. What we can propose, we haven't varicocele anything, what we can propose for this patient. And we know that when we do RT, we have a high rate of miscarriage and a low rate of pregnancy.
Yeah. So this is another interesting point. So DNA fragmentation is related even with several miscarriages, because the sperm is receiving several damages, and even if is working with the oocyte, it is higher chance to have a miscarriage. So your question, what to do when we have a high DNA fragmentation? Yes, what do we have to do? First of all, probably you have to increase your diagnosis process. So you start with the semen analysis and probably just with the myoxis. So this is the standard testing for male infertility. If you have high DNA fragmentation and is not increasing after the therapies with antioxidants, lifestyle changes, and all of these kind of things, probably you have to find other causes of infertility. So you have to do endocrine evaluation, you have to do genetic testing. So you should try to act on whole causes of known male fertility. And varicocele, you should make the varicocelectomy, because in my opinion, when you have a varicocele and you have an infertility that is reported by high DNA fragmentation, semen analysis that is altered, probably you have to do, together with varicocelectomy, even the compounds. So this is what you can do, but unfortunately there is still 30% of causes that are unknown and what we cannot do anything.
What you think about a paper who are published in Fertility, Sterility, and they do testis biopsy for this case of patient, and they have a nice result, a decrease of the miscarriage rate and increase of pregnancy rate. What do you think about this paper?
I think that I agree that treating this for sure is a concept of chance. So even lowering a bit the DNA fragmentation is a higher chance of having a good pregnancy and even having better success in any ART technique. So, and keep in mind that if you increase the male fertility, you can probably even lower the grade of ART. Maybe you can do just an IUI. So it is not uncommon to see these kind of things.
Thank you very much, Professor Busetto.
Yeah.
And we are going, and then Professor Virmani will introduce the next speaker.
It's great